condition called as circulatory shock. Circulatory shock. So we will discuss the circulatory shock. Just give me 1 minute. No problem. I will cover that. These are just hypertension only. Few slides related to hypertension. Okay, what is the main function of the heart? Yes, for what? To supply the blood to the tissue so that along with the blood, oxygen will be supplied. For any organ to function properly, it requires energy and it requires oxygen. So two things are required, energy plus oxygen. This is done by the heart. So heart is pumping to supply oxygen and nutrient to the tissues. If the blood is not reaching to the tissue, what will happen? Hypoxia. If there is hypoxia to the tissue, what will happen? Yeah, the cell or the tissue will not function properly or it will die. So our lecture is the same, that circulatory shock is nothing but any abnormality leading to decreased oxygen supply or hypoxia to such an extent that it will start to function abnormally. This is known as shock. This is known as circulatory shock. So decrease in oxygen supply to the tissue because of some circulatory problem to such an extent that it will do abnormal functions, or it will start its function is not proper, or it will start to die. This is called as circulatory shock. Okay. Now, based on this, there can be categories why the supply to the tissue decreases, why it will hamper. Either the heart is not functioning properly, that is failure of the heart, or maybe it is happening because of the cardiac muscle. We call it as cardiogenic shock. It could be due to heart is functioning properly, but the amount of blood which is required to carry the same amount of oxygen, if it is less, let's say 5 liters is the normal amount of blood should be there to supply the normal oxygen. If instead of 5 liter, if it becomes 1.5 liter or 2 liter, half of the normal, then it will not carry the same amount of oxygen. If it will not carry the same amount of oxygen, the tissue will not function properly. Again, this is one of the cause of shock. This is either hypovolemia or cardiogenic, the problem lying in the heart. Sometimes heart is also functioning properly. The volume is also same, but there is blockage, just like thromboembolism or something which is preventing the blood to reach to the tissues. This is also leading to hypoxia of the tissue to such an extent that it will start to derange its function or start to die. This is also called as a shock. So either blockage to the circulation. This is one of the example. Then it could be due to same amount of volume is there. Heart is also functioning properly, but the circulatory system get dilated. All the vessels get dilated. Throughout the body, there is massive vasodilatation. So the pressure which is created by the pump is not maintained in the circulation. So if there is less pressure, the flow will be less. Because let's say this is a bottle. This bottle is about, say, 200 ml. It should contain 200 ml of water, so there will be some pressure. If you make it only 10 ml of water, there will be no pressure created. If there is no pressure, then the flow will be decreased to such an extent that it will not supply same amount of oxygen. So either massive decrease in the peripheral resistance can lead to very little amount of flow, leading to less oxygen supply. This is also known as, or it is as it is coming because of the vascular system, it is known as vasogenic shock. vasogenic shock. Here, distribution is hampered. Distribution of the blood to the organ is hampered. That's why it is also known as distributive shock. So basically, the principle of shock is that whenever because of any cause, if the organ is not receiving, or the tissue or the cell is not receiving required amount of oxygen, it will start to function abnormally due to severe cellular hypoxia. The main feature is cellular hypoxia, which will lead to a condition called as shock. So this is our topic. So here is the definition. Oh, I have to take it here. Okay, we have the list. I have already here in my flash. So it is an acute failure of circulatory system. Causes we will see, but there is acute failure of circulatory system to supply the peripheral tissues and the organs of the body with adequate supply of blood or oxygen, leading to hypoxia. Inadequate if it is not properly supplying to such an extent that hypoxia, tissue cellular hypoxia occurs, and this will lead to derangement or death of the cell. This is called as circulatory shock. So as I told you, the shock could happen due to loss of blood or volume, blood or plasma, either of it. So it is called as hypovolemic shock. Hypovolemic shock, or it could be due to abnormal or slow or weakness of the heart. This is called as cardiogenic shock. Or it could be any problem in the circulatory pathway. It is not throwing the same amount of blood to the tissue. This will lead to obstructive shock. Or it could be due to vasodilatation, massive vasodilatation. So the distribution of the blood is hampered, not supplying the same amount of oxygen and blood to the tissues because of severe vasodilatation, because of decreased peripheral, because of the decreased blood pressure, and more blood is lying peripherally, not reaching to the tissues. This will lead to distributive type of shock. Okay. Now this picture gives you idea about different types of shocks, what is happening there. So ultimately, what is the main feature of a shock? Main feature of a shock is cellular hypoxia due to decreased mean arterial pressure. Mean arterial pressure is the average pressure in the circulatory system, which is required for flow of the blood to be normal. If mean arterial pressure, which is around 93, we have calculated in the previous lecture that diastolic is 80 plus 1/3 of the pulse pressure is mean arterial pressure, which is around 90 or 93. If it goes maybe around 70 millimeter of mercury, then the tissue or cells will start to show hypoxia, signs of hypoxia. So this is the main feature, that there will be tissue hypoxia and there will be decreased blood pressure or mean arterial pressure. So here in, let's say example number 1, Example number 1 is hypovolemia. Hypovolemia could be due to loss of blood, hemorrhage, or due to loss of fluid, diarrhea, urinary loss, vomiting. This will lead to, we have seen from the previous block that blood contains 40% of the cell and 60% of the plasma. In 60% of the plasma, 90% is water. So 90% of the water means if there is any sign or any disease related to the loss of fluid or loss of water, can lead to loss of plasma, can lead to decrease in the blood volume. So volume loss is the main feature of hypovolemic shock, either blood or the water. This will lead to loss of fluid and which is derived from the plasma. This will lead to loss of blood volume, and when the venous return is not proper, then the heart will not function same amount. It will not throw the same amount. That's why the cardiac output will be decreased. When cardiac output decreases, and we know that mean arterial pressure is equal to cardiac output into peripheral resistance. So there will be decreased mean arterial pressure. If cardiac output is decreases, this will lead to decreased mean arterial pressure. And if there is decreased mean arterial pressure, it will lead to less flow of blood to organ, less oxygen supply to the organ, and there will be this condition is known as shock, circulatory shock. This is hypovolemic type. Now, cardiogenic shock, as we know, the function of the ventricles or the muscles of the heart is to pump the blood with some force. Let's say the person suffered from myocardial infarction, massive myocardial infarction. Let's say 10 to 20% of the muscle is lost. It becomes fibrosed, and it will not create the same contraction force. If it is not able to pump the blood, cardiac failure, this will not, the cardiac output will not be same. Cardiac output, which is at least 5 liters of the blood, it may become 2 liter or 3 liter. This could lead to decreased mean arterial pressure, decreased oxygen supply to the tissues, and hypoxia. Another way of where the cardiogenic shock can happen is in arrhythmias. Person is okay, there is no myocardial infarction, but there are abnormal foci. All the muscles are contracting alone, not together. This can also lead to less pressure generation. If everyone contracts same time, there will be more pressure. If every single muscle fiber is contracting on, there will be no contraction at all. And there will be no cardiac output. There will be no mean arterial pressure. So mean arterial pressure will be decreased either due to valvular disease or due to arrhythmias or due to myocardial infarction. The person will have decreased cardiac output leading to decreased mean arterial pressure, leading to hypoxia of the tissue, and it is a shock. So two types we have seen, that hypovolemia, or the main feature, as we are saying in all the types of shock, the main feature is mean arterial pressure will be very low. And also there will be tissue hypoxia. These are the two main features. So if you want to diagnose a person who is having shock, just check with its O2 concentration. What is the arterial O2 concentration? Plus check the blood pressure. Blood pressure will be very low. And also, if the tissue did not receive oxygen, how will be the metabolism? Which type of metabolism will occur?
Anaerobic.
Anaerobic. Very nice. Mazen, thank you. So
Mishari,
thank you. So either usually the metabolism is aerobic with utilization of oxygen. If the person's metabolism or the cell's metabolism changes from oxygen to without oxygen, it will become anaerobic. Whenever anaerobic metabolism occurs, what will produced? It will lead to formation of lactate. It will lead to formation of lactate. So either you measure the blood concentration of lactate, or you measure the blood pressure, or you measure the oxygen. This will lead to diagnosis of shock, any shock. Either there will be very less mean arterial pressure, or the blood pressure is very low, lactate will be very high, and there will be hypoxia. This will lead to diagnosis of the shock. Similarly, another type, which is, we call it as vascular type. Here, the vasogenic shock. Vaso means blood vessels. Genic means it is started from the vessel. What type? Septic. Septic means any type of infection. If there is an infection severe in the body, which is not treated by antibiotic, then this may lead to abnormality in the capillary circulation. There may be increased histamine release, there may be vasodilatation, and instead of having the same pressure because of the size, if the size increases, the pressure will decrease. So this will lead to the decreased flow and hypoxia and the shock. So septic shock, vasodilator substance will be released by the bacteria or because of the tissue damage. There will be widespread vasodilatation. So total peripheral resistance will be released. Total peripheral resistance will be decreased, and this will lead to decreased mean arterial pressure, because we know mean arterial pressure means it is because of either cardiac output or by the total peripheral resistance. So here, severe decrease in the total peripheral resistance. Similarly, in anaphylaxis. Anaphylaxis is an allergic reaction, type 1 hypersensitivity reaction because of either some protein or by bite of any insect. This will lead to severe vasodilatation everywhere. Histamine release, the substance of allergic slow reactive substance of the SSR is released. This will lead to widespread vasodilatation all throughout the body, and person's mean arterial pressure will be decreased because of decreased total peripheral resistance. Now these two types, the vasogenic, the third one is neurogenic shock. We know that there is a normal vascular tone maintained by sympathetic supply. All the time sympathetic system is working. It is firing with some rate, maybe 5 stimuli per second or 10 stimuli per second. Some rate is there. If there is cut of sympathetic system, what will happen?
Vasodilation.
Vasodilatation, yes. So if the nerves are not stimulated or maybe cut or maybe no information coming, then there will be less stimulation leading to less vascular tone. This will lead to vasodilatation. So vasodilatation will lead to what? Decrease widespread vasodilatation leading to decreased total peripheral resistance decrease, which is leading to mean arterial pressure of the person is decreased. So these two, vasogenic and neurogenic, they all lead to what? The blood is remaining on the periphery, not moving toward the heart so that it comes in circulation because of big size of the vessels. The vessels are becoming vasodilated. So they will be remaining outside, and that's why it is known as distributive shock. All the three are called as, there is a problem of distribution. Okay, all the three are known as distributive shocks because same amount of blood is there, but it is not distributed to the required organ. Okay, why the hypovolemia occurs? Either hypovolemia occurs due to loss of blood, either in case of injury to the body during accident, during surgery, any type of or maybe rupture of pregnancy. This will lead to loss of blood. This loss of blood, or can be no loss of blood, but loss of plasma. Loss of plasma occurs usually when the skin is out or superficial area of the superficial skin of the body is lost because of burning. The bodies or the blood is exposed to the atmosphere and the plasma will be lost from the body. There can be loss of water only from ECF, extracellular fluid, like in case of severe vomiting or diarrhea. That's why whenever the person suffer from vomiting or diarrhea, what the doctor do? Doctor will do before the treatment, before any, maybe it is viral infection, maybe bacterial infection, maybe food poisoning. The main treatment is to supply the same amount of water which is lost. So they ask the person to take lot of water. Suppose if the person is having vomiting, if he cannot take water by mouth, then it has to be taken by IV. IV water should be replaced. So IV salines are supplementing to the water loss. Why all of these things are done? Why water should be replaced or why the blood should be replaced? Suppose in hemorrhage, the first treatment is to replace the blood. Either replace the blood or some fluid similar to the blood. Crystalloids has to be replaced. Why? To bring the mean arterial pressure back to the normal. That's it. To maintain the mean arterial pressure. So the main treatment strategy for any type of shock is to recover from the mean arterial pressure should be reaching towards the normal. Then the cause, in the second step, you have to treat the cause. So hypovolemia is hypovolemic shock, it widely studied shock as a prototype. So what are the manifestations? In this shock, what are the things happening? There is loss of blood or loss of fluid. If there is loss of fluid or loss of blood, how the blood pressure will be? Blood pressure will be hypotension. Severe hypotension will be seen. Plus, because of hypotension, you remember that whenever there is decrease in the blood pressure, the baroreceptors will get stimulated. This will lead to increased sympathetic system activity. This will lead to increased rate of contraction of the heart. So the pulse rate will increase. Pulse rate will increase. Rapid 3D. 3D means just like a thread, not fully full with blood. There are arteries, but the pulse will be very thin. The skin is cold, pale, and clammy. Why the skin is cold, pale, and clammy? First of all, loss of fluid. Yes. Then vasoconstriction is there, and vasoconstriction will shift the blood to the center part of the body or to the important organs like the brain and the kidney. These are the things. One of the sign of the shock is as less blood. So less blood is going to the kidney, and the kidney will produce very little amount of urine. So oliguria, hypotension, and mean arterial pressure. The mean arterial pressure we have seen hypotension is same. These are the pictures, or these are the areas by which you can, and the increase in the lactate. These are the three things which will diagnose you that the person is having shock. Any type of shock, there will be oliguria, there or anuria or less amount of the urine formation, plus severe hypotension, plus lactate level will be increasing. Normal lactate level is ranging between less than 1.5. If it becomes more than 2 milliequivalent per liter, then it will be a definitive diagnosis of person is suffering from shock, or maybe it is having hypoxia. That's why the person is shifted to the anaerobic glycolysis. Intense thrust, because water is lost from the body, there will be activation of the thirst center. So person will feel as if he have to take more water. Respiration will become rapid just to push the more blood towards the center or towards the heart. Restlessness, because hypoxia of the brain causes person to be restless, not thinking, not knowing what is happening. And also restlessness will make contraction of the muscles. So that muscle blood will also be shifted towards the heart and towards the brain. So in hemorrhage, what is happening actually? Loss of blood leading to decreased blood volume, leading to decreased venous return, leading to decreased stroke volume, leading to decreased cardiac output, and leading to decreased mean arterial pressure. So mainly one of the sign of any shock is hypotension, severe hypotension. And to treat, you have to increase the volume. If it is hypovolemia, you have to increase the volume. If it is due to cardiac failure or due to pump failure, you have to give some drugs which can cause increased force of contraction. So this picture, this diagram tell you that in all these types of shock, or whenever shock occurs, whenever the body is suffering from shock, the body itself will try to overcome this shock. By what? By what it comes? It is stimulating the baroreceptor, because the pressure is easily detected in the baroreceptors, and then to increase it, either baroreceptor reflex will start, also the renin-angiotensin-aldosterone system will start, and there will be change in the capillaries. The capillary pressure will change. Capillary pressure will change, and all of them leading to bringing the mean arterial pressure back towards the normal. How? Baroreceptor will cause increased sympathetic outflow here. They will lead to increased heart rate, increased contractility, and increased cardiac output. Similarly, on the peripheral side, because of increased sympathetic activity, there will be vasoconstriction. This will lead to increased total peripheral resistance. TPR is nothing but total peripheral resistance. And constriction of veins also there. Arterioles will cause TPR increase. Veins will cause pushing the blood towards the heart. So venous return will increase. In long-term mechanism or during shock, the renin-angiotensin system will get activated. It will cause release of angiotensin 2 or formation of angiotensin 2. This will lead to vasoconstriction. So total peripheral resistance will increase. Also, it will activate the aldosterone. Aldosterone is a hormone coming from the adrenal cortex. This will lead to more absorption of sodium by the kidney, and along with it, more absorption of water. So it will increase the blood volume. Whenever increase in the blood volume occurs, it will bring the blood pressure or mean arterial pressure back towards the normal. In the capillaries, there will be decreased hydrostatic pressure. So more blood, the absorption will occur. Instead of filtration, there will be fluid absorption will be increased due to decreased hydrostatic pressure, and the blood volume will increase. So these are called as compensatory mechanism, safety mechanism. The body will try to overcome, yes. But there are stages. In some, if the loss is little bit, body can recover on its own by these mechanisms. Okay. Before, no, this is the shock. When the person suffer from shock, if the amount of shock, or maybe you can say loss of fluid, is not much, then body will recover on its own by these mechanisms. These are inbuilt mechanism. Sorry, it is not changing. Okay. So similar changes are shown here in the minute steps of the compensatory stages. Okay. So compensatory reaction, why the body will shift from shock state to the normal state by on its own. These are called as compensatory reactions. Vasoconstriction will occur, tachycardia will occur, venoconstriction will occur. All of them will lead to more more cardiac output and more blood pressure. Tachypnea will cause more thoracic pumping. Restlessness will increase the muscles to push the blood towards the heart. Movement of the fluid will occur in the interstitial fluid into the capillaries. There will be secretion of vasoactive substance like norepinephrine, epinephrine. There will be increased secretion of vasopressin. This will cause more absorption of fluid from the body, from the kidneys. Then renin-aldosterone system will cause more absorption of salt and water. And in long term, even erythropoietin will be released. Erythropoietin is a hormone to increase the number of RBCs, synthesis of RBCs, and formation of protein will also increase. These are the compensatory stages of compensatory changes of the shock. But sometimes they are not, you can say, not useful and not sufficient. So the person will land into second stage. This is the first stage. If the loss is minimal, it can recover on its own because of these inbuilt mechanism. So the aim of these changes is to bring the mean arterial pressure back towards the normal. Okay. If these mechanisms did not work, or the loss is more, fluid loss or blood loss is more, then the person will land into the progressive stage of the shock, or uncompensated. Progressive stage means there will be not sufficient increase in the blood volume, leading to decrease, not sufficient increase of the mean arterial pressure. So if they are not treated, then the person may land into next stage, that is called as uncompensated or progressive stage. Okay, this diagram is showing you that if initially normal mean arterial pressure is suppose 100 millimeter of mercury, because of loss of fluid or hemorrhage, the the pressure becomes 50 millimeter of mercury. Mean arterial pressure becomes 50. That the person is suffering from shock now. But due to compensatory changes, again, it will reach to, in maybe about 4 to 6 hours, it will reach to the normal. This is called as compensated stage of shock. But if the loss is more and the effect is, or the compensatory mechanism is not sufficient, then the failure will lead to death of the person. The cells will not recover from the hypoxia. Okay. So non-progressive stage is also known as compensatory stage. On its own, the body will recover. No external things are required. No need for any blood or any volume or any drug. It will automatically, within 2 to 3 hours, it will bring back the normal mean arterial pressure. Okay. But in progressive stage, the decrease in BP Decrease in blood pressure and cardiac output is there. Here, without therapy, the shock will get worse or it will not recover. That means you require some IV fluid or some blood transfusion or some drugs to overcome the problem. So this is called as progressive stage. Third stage is the refractory stage. Refractory means even though you do anything, either you infused some volume, infuse some blood, give some drug, still the shock will not recover. The person will die. This is called as uncompensated, or you can say the refractive stage of the or irreversible stage. Irreversible and will not respond to the treatment. There is a cardiogenic shock and the person is old and he is having some other problems also. So all the organs will start failing one by one. There may be failure of kidney first, more accumulation of uric acid, and blood urea nitrogen will increase. Then followed by failure of lungs. There may be accumulation of CO2 inside the body, decrease O2, decrease oxygenation. Then followed by failure of brain. So all one by one, the organ failure will start. This is called as refractive stage of shock, and this is dangerous. So all these things can happen in any department. Either it is medicine or surgery or OB/GYN or orthopedics, anywhere, anything will happen. Irreversible refractive stage of shock occurs. Why? Because of cerebral ischemia already happened. If the oxygen supply to the brain is not improved for a long time, then it will start abnormal, or you can say irreversible changes. If the myocardium is not strong enough, this will lead to, again, even if you have normal blood volume, it cannot pump. There can be changes in the respiratory membrane because of hypoxia. Respiratory membrane changes, and this will lead to acute respiratory distress syndrome. Acute respiratory distress syndrome. That time the person will not able to oxygenate the blood. So blood is normal, even heart is normal, but lungs becomes totally injured. So now we know that how the shock look likes. Shock means there are three things you have to observe. There may be hypoxia, tissue hypoxia will be seen. There will be lactate level will increase, and there will be mean arterial pressure will be very low. Now, for this, you have to know to find out the cause. Where is the cause? Is the volume of the blood is say normal? If it is normal, then you have to look for is the heart is pumping or not pumping properly. So second type of shock is cardiogenic shock, where normal volume is there, but the function of the heart is very low. It's becoming very weak. It could be due to inability of the heart to contract or inability of the heart to pump the blood, may be due to damage because of the myocardial infarction, or maybe due to arrhythmias. Any type of arrhythmias can lead to, or maybe there is valvular disease which is not allowing the fluid to go out or the volume of the blood to go out. And all these things will be seen based on the type of shock. If it is myocardial infarction, you will see ECG changes. Okay. If it is arrhythmia, also ECG changes you will be seen, or valvular damage, and you have to see the changes because of in the ultrasound, or it is called as 2D echocardiograph. So all this will be evident from that area. And the blood, if there is less blood, then if the heart is not pumping required amount of blood, it is remaining on the venous side, right? It will be built up. Left ventricle is not pumping properly. This will go to the left atrium. From the left atrium, it will go to the lungs. So lungs will also be get congested. And then from the lungs, it will go to the right side of the heart. So right side of the heart will also have more blood, maybe on the venous side. So you will see edema present. Edema will be appeared in case of which shock? The cardiogenic shock. So pump failure lead to peripheral edema, and even jugular venous pulse will becomes more. Pressure in the jugular veins will be more. These are the symptoms. In case of distributive shock, distribution, there is decreased peripheral vascular resistance. There is mainly decreased peripheral vessels will dilated now. Now this dilatation could be due to inflammation due to sepsis. If gram-negative bacterial infection usually leads to, if not treated with antibiotics, it will lead to release of chemical from the inflammation, and this will lead to dilatation of the vessels. Or it could be due to loss of vessel tone, vascular tone because of the sympathetic blockage. This could happen due to spinal cord injury because the vessel nerves are coming from the spinal cord injury. Or it could be due to severe allergic reaction. Severe allergic reaction. This will lead to release of histamine, and then that's why there will be vasodilatation everywhere in the body. So more blood is on the peripheral side, and it is not pushed to the heart. So heart is not giving proper amount of cardiac output. And also because of the vasodilatation, mean arterial pressure is very, very low. So anaphylactic shock is systemic response of the inflammatory mediators released by type 1 hypersensitivity, histamine, acetylcholine, kinines, leukotrienes, and all these substances are released. All of them will cause vasodilatation. So if all the vessels, all the arterioles get dilated, then the pressure will be very low. Okay. In septic shock, due to gram-negative bacteria, exotoxins are released by these bacterial from the gram-negative bacteria, and this will lead to vasodilatation. The first shock, that is the hypovolemic shock, there is decreased blood flow to the periphery. That's why the body will remain cold. And hypovolemic shock is known as cold shock. Another name for hypovolemic shock is cold shock. You will see, touch the patient skin, you will see the skin is having less temperature. You can feel that it is not having the same amount of same flexibility, or you can say the same texture of the skin is lost. Also, the fluid is, or the blood is moved inside. That's why you will find it is very cold. Opposite to that, in septic shock, as it is due to infection, there will be fever. And also another one is not only fever, but there will be vasodilatation. So blood is on the peripheral side. So it will give you a warm feeling. If you touch the patient, either due to fever or due to vasodilatation, it will be warm. That's why it is called as warm shock. Septic shock is known as warm shock. The most dangerous shock out of this is septic shock, because if the person lands in septic shock, the chances of death are 30 to 50%. Because of the temperature? No, not because of temperature. It is because of the bacterial infection. Because bacterial infection will lead to damage to many organs and damage to the microvessels, capillaries, and also the arterioles. This will lead to either even thromboembolic phenomena will also start, and person will start having bleeding disorder. Okay. Neurogenic shock is whenever the vascular tone is decreased because of sympathetic discharge or sympathetic supply to the blood vessel is decreased because of injury to the spinal cord. Either injury to the spinal cord, or maybe during surgery, if you give more amount of general anesthesia because you want to suppress the activity of the nervous system. If it is affecting the sympathetic also, this will cause decreased supply or decreased signaling of the sympathetic system. This depression, central nervous system depression, will lead to decreased sympathetic output and vasodilatation, leading to decreased peripheral total peripheral resistance will increase, and mean arterial pressure will be decreased. So depressant effect of general anesthesia, brain injury, spinal cord injury, all will lead to a type of shock which is called as neurogenic shock. Yes, lactic acid plus thromboembolic phenomena. Okay, this was about the shock. Whenever blood supply to the tissue is reduced to such an extent that tissue hypoxia occurs and the cellular function is lost, this is known as shock. But there is similar term used here, like fainting and syncope. Feeling of dizziness whenever you just stand up from a sitting position or from lying down to sitting position or from any position you've changed, you feel that is you are not able to concentrate or your head get dizzy. This is due to decreased blood flow to the brain for a moment, yeah, just for a few seconds only. This is just not causing unconsciousness, but you will be thinking that the head is revolving, something like that. Yeah, this is called as fainting. Syncope is slightly more. There is impairment of consciousness. There is impairment of consciousness due to reduction in the cerebral blood flow. Now, cerebral blood flow is reduced for a moment, and the person will feel as if he is lost consciousness. And again, gain reconsciousness if the body is or the person is lying down, or you just start to push the legs inside so that the blood flow is slightly increased. This will regain the consciousness. Why syncope or occurs? This is due to vagus nerve stimulation. Vagus nerve stimulation. Vagus nerve stimulation will cause decreased heart rate, so decreased cardiac output. Also, sympathetic discharge is decreased. Whenever parasympathetic increases slightly, sympathetic discharge will decrease, and this will lead to vasodilatation, and blood will be pulled towards the extremities. So there will be two things: bradycardia will be there, and blood will be on the peripheral side. This will cause decreased blood flow to the brain for a moment. This will lead to the slightly loss of consciousness for some time. This is called as syncope, occurring due to vagus nerve stimulation. That's why it is called as vasovagal syncope. This can occur in case of fears, very severe fear. You have seen something which you are not expecting, maybe in the dark, maybe in the night, maybe in the movie. You have seen something and you become unconscious for some time. Or due to severe pain. Due to severe pain also, vagus nerve can get stimulated. Other forms of syncope are postural. As I told you, if you change your posture from lying down or sleeping position to the standing, suddenly you will feel dizzy and loss of consciousness. This is postural. Mainly, this is in a person who is having either hypovolemia or maybe they are taking some drugs. They are taking some drugs related to some disease or maybe hypotensive drug, the drug which will cause hypotension. This will cause postural hypotension and this will lead to postural syncope. Another form of syncope is micturition syncope. While passing the urine, the person will feel dizzy and fall down. More common in old age. More common in old age. This occurs due to orthostatic hypotension. The thing is, the person's changing in the position of the body leading to hypotension. Commonly seen in old person when they wake up in the night, midnight, for going to the bathroom. They go to the bathroom. First of all, there is a change in the posture leading to decreased blood flow to the brain. Plus, during voiding of the urine, there is some stimulation of the vagus nerve. This lead to bradycardia and this lead to syncope. So they will get injured themselves when they are in the bathroom, fall down. Even pressure in the carotids, if you apply pressure on both the carotids, this will lead to stimulation of vagus nerve. And this will be called as carotid sinus syncope. Sometimes syncope occurs due to while eating. You are in a hurry and then you take a big chunk of the food as one, and then it got stuck into the esophagus. At that time, even vagus will be stimulated and the person will fall unconscious. This is called as deglutition syncope. In severe cough also, continuous cough, there is no pause in between and from deep inside. There is no pause in between. This lead to, again, more positive pressure in the in the chest. So less blood flow in the chest, less venous return, and for a moment there will be less blood flow to the brain. This is called as cuff syncope. So all these are something related to shock. It's not actually shock, but the blood flow to the brain is momentarily decreased. So that's why it is included here. With this we come to an end of our lecture. Both the lectures, that is microcirculation and shock. Shock is very important because you will find the clinical cases, the patients everywhere. Whenever you go to any department, you will find. So whenever you think that the blood pressure of a person is decreased, let's say systolic blood pressure becomes 90 or 80, the person is landing into the shock. First and foremost thing to treat is to bring the blood pressure back to the norm. By any means, either you infuse saline, either you infuse blood, or you increase the force of contraction by giving epinephrine, adrenaline injections, which will cause more forceful contraction. So increase the second one is the increase, treat the cause. So first thing is try to bring the blood pressure back towards the normal. Same time, blood is moving now. Now you have to add oxygen also, so that oxygenation will become, because you want to treat the tissue hypoxia. You are increasing the pressure so that blood will reach. You have to add oxygen so that it will add the tissue hypoxia will be relieved easily. Later on, you can treat the cause. If it is due to injury, you have to repair and make the amount of blood to the normal. If it is a brain injury, if it is a spinal cord injury, or if it is infection. The third thing in infection is you have to start with antibiotics. The higher antibiotics to control the organism to multiply. So like this, you have to treat. So very easy to, it's easy to treat, and there are steps. First of all, you identify and start maintaining the blood pressure norm. That's why in the clinic or anywhere you go, if they see your blood pressure, because maybe you have suffering from uh, even simple fever, or maybe you are suffering from vomiting or diarrhea, they see your blood pressure first. If the blood pressure is normal, then they will give the second line of treatment, antibiotics or some other drugs. But if the pressure is low, they will either ask you to drink more and more. If you are having vomiting, then they will admit you and push the fluid through the IV. So IV fluid should be given so that the pressure should come back to the normal easily. Okay. This is how the shock will be treated. Thank you very much, my online
Doctor,
users. Yes, please.
I want to ask if you will send us the record of the lecture.
Yes, recording is done, alhamdulillah, in
Alhamdulillah.
the Teams meeting.
Yes.
I included everyone's email in the Teams meeting. Maybe you will find it in respiratory group.
Okay.
In
Thank you.
respiratory block, we had all your email addresses. In the respiratory group, I added one channel as CVS. In the
Okay.
CVS, I added one meeting as lecture, microcirculation, and shock. In the file of that meeting, you will see recording after maybe 5-10 minutes. But still, if you are facing some problem, I will download this and try to send the link to you. No problem.
Okay. Thank you.
Yes, one of our student is saying that we have something missing from our previous lecture. Okay, what is the number of that? Okay. Hmm, no problem. Regulation of blood pressure, although we concluded the yeah, lecture number 11. Yeah, only few slides. That is after mechanism we already discussed. That was the main mechanism actually. So up till here we covered. I will show you here. This one. Sorry. What happened? Okay, then. Oh, there is go to. Is there any go to slide? Okay. So in the regulation of blood pressure, we saw there is short-term mechanism, there is long-term mechanism. In short-term mechanism, the baroreceptor we discussed in detail. In long-term mechanism, we discuss renin, angiotensin, aldosterone system. These are mechanisms responsible for regulating the blood pressure in a normal person. If the blood pressure is not regulated, then we either it will be increase or it will decrease. Okay. So either it will cause hypertension, that is increase in the blood pressure, which is from which side to increase. That means which level it should increase. We should know the normal range. Normal range for systolic blood pressure is between 100 to 140. If more than 140 systolic, we call it as hypertension. Similarly, diastolic also range is between 60 to 90. Anything more than 90, we call it as increase in blood pressure or hypertension. So hypertension means your systolic may be more than 140 or your diastolic may be more than 90 is called as hypertension. Similarly, if the blood pressure is less than the normal, less than systolic is 100 is normal. If it is less than 100 systolic is hypotension. Similarly, diastolic is lower level is 60. If it is less than 60, it is hypotension. So if the blood pressure is not regulated properly, it can land into hypertension or hypotension. The Society for for the Cardiovascular System, they have decided to not only give the hypotension and hypertension, but they describe hypertension in the stages. Anything systolic less than 120, they say is normal blood pressure. Anything no, less than 120 only. Between 120 to 139, although it is normal range, but they say it is pre-hypertension. Pre-hypertension. That means if you don't change your lifestyle or eating habits, then you may land into hypertension. So pre-hypertension. Similarly, if it is between 140 to 159, they say stage 1 hypertension, and stage 2 is more than 160. More than or equal to 160 is known as second degree hypertension or second stage of hypertension. Similarly, you can follow the diastolic also. Diastolic less than 80, they say normal. Between 80 to 89 is they says pre-hypertension, and between 90 to 99 as stage 1 hypertension, and more than 100 is stage 2 hypertension. Now, why hypertension occurs? Hypertension occurs, broad classification, either due to abnormalities of some other organ. Blood pressure is raised because of abnormality of some other organ. That's why we call it as secondary hypertension. If the blood pressure is raised due to endocrine problem or CNS problem or respiratory problem or kidney problem, we say it is a secondary to that. So that is a secondary hypertension, which is only few percent, less than 10% is secondary hypertension. But main is primary hypertension when you don't know the cause, why the increase in the blood pressure. So hypertension could be primary when you don't know the cause. If you know the cause, this is called as secondary. So secondary hypertension could be endocrine or CNS or kidney problem leading to increased blood pressure. 90% of the cause is unknown cause of hypertension. And there are so many hypotheses. These are all hypothesis. That means it may not be a diagnostic feature. That may not be a, if it is this, you will say hypertension. No, it may be some, in some cases may be present or it may be not present. So these are hypotheses that it could be due to problem related to the kidney management of salt, how the kidney handle with the salt, or it could be due to excessive salt intake, or due to maybe potassium or calcium problem, levels of the problem, or could be plasma membrane abnormality. So these are all hypotheses. We cannot say that this exactly this will cause the hypertension. So this is 90% of the cases are due to this. Secondary hypertension because of some problem related to other organ, other system. So renal hypertension, endocrine, or neurogenic hypertension. Here you have to treat the cause. If the kidney is having some tumor, remove the tumor. If the kidney is having atherosclerosis, you have to repair the atherosclerosis. If the endocrine system has got some tumor, excessive secretion of some hormone, you have to reduce, treat that, and the hypertension will be gone. So this is secondary hypertension. And if you don't treat the hypertension, what will happen? If you keep the pressure more in the vascular system, it may lead to complications. Long-standing untreated hypertension can lead to heart failure, can lead to stroke. There is damage to the brain, or it could be due to, or it can lead to heart attack. It can lead to hemorrhage because more pressure keeping in the capillaries or small arterioles may burst. More commonest is the in the stroke, that is in the brain, some leakage of the blood is occurring, or maybe in the eye, in the retina. Retinal hemorrhage is because of the increased blood pressure. Also maybe in the kidney. Kidney can also show some hemorrhages and damage to that area. So renal failure, retinal damage, all these are the causes or the complication of the hypertension. That's it. So main aim is to treat the hypertension by antihypertensive drug as well as lifestyle modification. And you know that the blood pressure is mainly due to salt and water and this. That's why whenever you go to the clinic or to the physician and you are first initially diagnosed with hypertension, they will say stop eating salt, excessive salt. Minimum amount you can take, but excessive salt in the form of chips or some packed food which contain excessive salt can lead to worsening of the hypertension. And also they will ask you to do some exercise because exercise will make vasodilatation and decrease in the blood pressure. So moderate exercise, lifestyle modification, eating properly, having more vegetables, reducing fats, all these are the initial. If it is not treated, then you have to go for drugs. Like those drugs are starting with diuresis that remove the excessive salt from your body, or maybe ACE inhibitor. We have seen that blood pressure is increased because of converting into angiotensin 2 by the ACE angiotensin converting enzyme. If you block this angiotensin converting enzyme, then your blood pressure will also come down, or maybe some beta blockers if there is a related to the heart. This is how the blood pressure is treated. Okay, this is all about all our lectures, and inshallah, if you have any, if there is any problem related to any of these lectures, you can send me message, you can send me email with your question, and we will try to answer it. Thank you. So stop recording. Recording has started. I want to stop. Okay, stop recording.